the med table part 3 for central nervous system drugs, which of the ones which we have discussed so far, mostly central nervous system depressants in part 1 and 2, and in 3, we are going to review just the anti-Parkinson's drugs. If you remember from anti-epileptic drugs, a lot of them cause severe changes in mental status or maybe sometimes bleeding in the gums because they altered the nerve impulses conduction, inhibiting the excitatory action. However, when we talk about anti-Parkinson's drugs, this is a little less of a CNS depressant drug, if you would call. Even though they cross the blood-brain barrier, the effect of these drugs on the person is significantly, low in toxicity as compared to the other drugs. Just for a preview. So what do you know about Parkinson's? I hope you do know that it is a neurodegenerative disease, right? And it affects the dopamine, which is a neurotransmitter. There's decreased secretion of dopamine in the substantia nigra of the brain, which leads to slow movements of the voluntary muscles, changes in mood, and tremors and bradykinesia. Slow movements, hypokinesia, bradycardia, sometimes tremors, slow movements, twitching, tremors are all very common. If you look at the differences or the decrease in dopamine levels compared to the acetylcholine levels, they too are balanced in the body. So when the dopamine levels go down, the acetylcholine tries to be in excess to balance of the excess of the dopamine. If you think about Parkinson's, when there's low levels of dopamine, what you could do is increase the cholinergic effect. There could be an increased cholinergic effect. So there are two ways you could treat this this condition. You could either increase the dopamine levels or decrease the cholinergic acetylcholine levels. So in increasing the dopamine levels, the main drug that's used predominantly in current practice is levodopa, carbidopa, which are precursors of this dopamine. So what happens is this combination of levodopa and carbidopa, that's the Cinemet is the brand name, that helps in improving the voluntary movement and kind of helps this patient manage the symptom. There's no cure for Parkinson's. Some of the side effects are drowsiness, confusion, some lightheadedness, because anytime any drug crosses the blood-brain barrier, there might be some changes in terms of lethargy, dizziness, and lightheadedness. So any of the CNS drugs, you can expect this, right? Let's talk about anticholinergics. So we talked about acetylcholine levels being up. So if you want to decrease it, what would you do? You should give them anticholinergics. A drug that's more commonly used for these patients are benztropine. If you look at the name, it ends with tropine, right? Like atropine, it ends with tropine. Atropine, benztropine. So these drugs, what they do is they kind of decrease the smooth muscle, like tremors and rigidity, and they relax the muscles. Hence, they help in managing symptoms. Again, they cannot cure. However, you will learn more when you talk about anti-nervous system, autonomic nervous system drugs, especially the parasympathetic drugs, about the side effects that include sludge, where they'll have dryness predominantly. When you give an anticholinergic, you could expect decreased salivation, decreased lacrimation, so their eyes will be dry, mouth will be dry, and then they might have urinary retention and difficulty with having a bowel movement sometimes. So these are side effects. The last one is MAOI. Those are called monoamine oxidase inhibitors. These are sometimes but rarely used. Example, sertraline. Important to remember is these drugs should not be stopped immediately, and they should be avoided. The patients who are on this drug should not be taking vitamin B6. They should also be careful about foods that are rich in tyramine, like unprocessed cheese, some types of meat, and fish. So that's something we should be teaching patients. As far as other drugs, we should educate them about possible dark urine and sweat in some drugs, and just like that in other drugs as well, even in phenytoin. Thank you.